Hi, my name is Andrew Colifvada, and I want to thank you for taking the time today to learn a little bit more about our products. I encourage you to contact us with any comments, questions, or new product ideas you might have.
Seymour 2 Wound Care Model 0910 is one of our most popular wound care models. Seymour was molded from a 74-year-old woman with amazing detail. Seymour displays stage 1 through 4 pressure ulcers, suspected deep tissue injury, an unstageable wound, and a dehisced wound. On the left side, you have a stage 1. On the right side, you have a stage 2. Stage 3 on the left side of the model, with a small amount of undermining and tunneling, and a large stage 4 on the coccyx, displayed with some eschar on the edge and slough traveling down into the wound. In the center of the wound, you can see exposed bone with osteomyelitis. The top of the wound displays significant undermining, and the lower left side of the wound has tunneling. The left side of the model shows an unstageable wound as the wound bed is not visible. On the right side of the model, you have a DTI, with a dehisced wound where you can see the small red dots left from the sutures. In the gluteal cleft is a possible rectal fissure. Seymour 2 Wound Care Model is made of a unique material that permits the application of negative pressure wound therapy dressings. This can be done on the stage 4 and dehisced wounds. The edges of the dehisced wound will actually start to close when the negative pressure pump is activated. It is recommended not to leave your dressings on overnight. If you do so, it may be necessary to use an adhesive remover, such as Goo Gone, to remove any sticky residue, followed by a cleaning with alcohol to remove any oil left from the adhesive remover. Seymour is also a great tool to teach proper measuring skills, which is critical to ensure all staff are measuring the same way, so that charting is accurate. And with this information, the current treatment plan can be evaluated. Wound assessment has become critical to the operation of health agencies, as inaccurate wound assessment can affect reimbursement, cause inaccurate reporting of patient outcomes, and the appearance of potential adverse events. This model makes it possible to visualize and understand the differences in wounds, and once the different etiologies are understood, you can discuss and devise treatment plans that will deliver optimized patient care. You are able to demonstrate and practice wound cleansing, classification, staging, and assessment, as well as the measurement of wound length, depth, undermining, and tunneling. The positioning of the wounds permits multiple dressings to be demonstrated at the same time, a great teaching tool for healthcare professionals. Seymour 2 Wound Care Model is available in lightly pigmented and darkly pigmented colors, and an optional carrying case, Model 0901, is available.